Thank you, everybody. Thank you. As always with a UN event, our time is very tight, so we're going to move forwards very quickly. Excellencies, colleagues, and friends, it is a pleasure to welcome you to the launch of the Midwifery Accelerator and Global Coalition. Thank you for your commitment to midwives and your acknowledgement of their pivotal role in the survival, health, and well-being of women, girls, and their children. I wish my role this afternoon could be one of celebration, that I was here to congratulate on a job well done and rally us for one last mighty push to 2030 and the ending, once and for all, of the needless and intergenerational impact of maternal and newborn death. Instead, despite the determined hard work of so many and noteworthy accomplishments we are about to hear from our distinguished speakers, prospects for women and girls around the world are worse than ever, and we are in crisis. The multilateral system is in tatters. The already inadequate development in humanitarian architecture is crumbling. International laws are brazenly being violated, and violence and lies are going unchecked. We cannot pretend it is otherwise. And we cannot afford now to squander time and resources trying to innovate systems that no longer exist. In the midst of this dizzying change and uncertainty, I think we here are actually quite fortunate because our work is rooted in irrefutable fact. First, the health, well-being, education, and equal participation in the workplace and society at large of women and girls are the keystone for family, community, and national peace and prosperity. Second, no matter the surrounding calm or chaos, people have sex, women and girls get pregnant, and babies are born. Third, the majority of stillbirths, maternal, newborn deaths, and injury are preventable. It's a fact. We know what must be done so that every pregnancy is wanted, every pregnancy and delivery are healthy and supported, and every mother and caregiver equipped with the information and resources they need to give their children the building blocks for optimal cognitive, emotional, and physical growth. In addition, even with imperfect data, we know where the majority of mortality and morbidity are occurring, and I implore you to prioritize women and girls in humanitarian and fragile settings. My final and fourth hard point of fact: if we, a global coalition of shared belief and ambition, do not act with urgency, courage, and principle, if we are unwilling to center our work on the needs of others and not our ideologies, priorities, and timelines, if we are not prepared to consistently use our voices, access, and leverage to defend and enable midwives, frontline workers, and reproductive services, women, girls, and their newborn babies will continue to die, and in even greater numbers. Thank you. And now, and I appreciate having the privilege and opportunity to say my piece and share my fears about the world around us. Now, we can move on to a proper celebration of midwives and the extraordinary work that has happened to create the Accelerator and Global Coalition. And I would like to turn, please, to the Executive Director of UNFPA.
Thank you very much, Madam Chair, Excellencies, distinguished delegates, esteemed colleagues, and community leaders, dear young people. Greetings of peace. Peace has been the noble pursuit of the United Nations for the past 80 years. And peace is the fervent desire of every woman and every girl that UNFPA serves in over 150 locations around the world. Today, we meet at a time when our shared mission of peace, human rights, and development is more vital than ever, and where we count on people like you, people of goodwill, for solidarity in forging a brighter future. This is a world of unprecedented challenges, that's true. amongst the most profound being the continued injustice of women dying while giving life in pregnancy and in childbirth, usually from entirely preventable causes. How can it be that in this day and age, each and every 2 minutes, a woman dies from complications in pregnancy or childbirth? And in places affected by conflict, maternal mortality more than doubles. These are not just numbers. They're real lives we're speaking of. And let me tell you what I heard from Aisha, a young woman displaced from a traditional village in Cameroon after repeated flooding and then violence by armed groups. She confided, "I'm so scared for the baby in my womb and for myself." Pull back the curtain behind every maternal death, and you will find a clinic that didn't have essential medicines, a community without skilled midwives, and a crisis putting basic human care out of reach. With seemingly never-ending conflicts, with growing economic uncertainty and more frequent climate disasters, women's health needs are surging, and that's happening as resources and too often political will seem to be far less reliable. Yet we know that major progress is possible. Change happens when we mobilize the full weight of local communities joined by the international community. Change happened over the past 25 years, during which the world saw a remarkable 40% drop in global maternal mortality. And while, yes, progress has slowed more recently, there has been a 10% decline in maternal deaths since the year 2015. And let me emphasize that the most gains were made by the least developed countries. Progress is indeed possible. Even with setbacks from COVID-19, we were beginning to get back on track in most countries. 3 powerful examples really stand out: Tanzania, Sierra Leone, and Nepal. Through impressive government leadership and strategic investments, Tanzania cut maternal mortality by 79%, Sierra Leone by 52%, and Nepal by 1/3. Seeing is believing. Tangible progress follows when countries prioritize, when they prioritize women's health. And this means thousands of lives saved, mothers and their babies poised for a healthier future. Importantly, we have the tools to replicate the success. We have the cost-effective, evidence-based strategies. We know what works. And that's all good news. Yet we can't rest on our laurels while steep funding cuts right now are forcing countries to roll back vital services for maternal, newborn, and child health and putting fragile gains at risk. We need to go further, and we certainly need to go faster. It is Native American wisdom that tells us we will be known forever for the tracks we leave. Now is the time to expand all of the proven interventions that we have at hand. Now is the time to ensure equitable access to quality care, especially for any woman who is poor, because she will be the one too often left behind. And here is where the transformative power of midwives shines bright, because midwives save lives. With proper investment in the midwifery profession, did you know that midwives could deliver up to 90% of essential sexual and reproductive health services? That includes vital antenatal, delivery, and postnatal care. And what's more, every dollar poured into midwifery yields a 16-fold return in economic and in social benefits. And that's an outstanding return on investment. It's a financially sustainable solution all around. Midwifery care significantly reduces mother and newborn complications. Midwives are leaders, they are embedded in communities, and therefore better able to reach remote and marginalized groups. And that's the path to bridging inequalities that we seek, the inequalities that fuel maternal deaths. Midwives provide holistic care that respects women's preferences and minimize medical intervention. They improve the overall experience of childbirth, and they're a trusted, stabilizing force within their communities. I'm telling you all of this so that you understand that we must act to end the global shortage of nearly 1 million midwives. It's a largely female midwifery workforce. Unfortunately, it remains persistently under-recognized, underutilized, and underfunded, despite all the overwhelming and long-standing evidence in support of the midwifery model of care. And that's why UNFPA, with the International Confederation of Midwives, ICM, with WHO, UNICEF, and other terrific partners, are so proud to launch the Midwifery Accelerator, hot off the press. Thank goodness. Thank goodness we now have a global blueprint and a fearless coalition, a coalition that is going to close the midwifery gap and hasten progress towards ending maternal and newborn deaths before the year 2030. And our unwavering promise is to educate, to deploy, to retain and empower midwives, because every woman everywhere, she deserves safe, respectful, quality care when she brings life into this world. And a strong, well-resourced midwifery workforce defines the pathway to our joint success. And you know, safe birth is not, it's no longer a technical challenge. Rather, safe birth is now a political choice. Governments hold the power to enact policies, to allocate those critical resources, and to build robust health systems that protect and safeguard lives. And I do urge member states to prioritize and to set measurable reproductive, maternal, and newborn health targets. These targets should be aligned with the Sustainable Development Goals. And UNFPA will certainly stand shoulder to shoulder with you and all partners in this critical endeavor. The survival and the well-being of every woman and every newborn is no less than the foundation of a strong family, of a resilient community, and of a prosperous society. And again, we will be known forever by the tracks we leave. So let us galvanize our collective will and stand united in our complete, interconnected humanity. The status quo, it's done, it's over. Let us seize this moment for resolute action to create a world where everyone has the opportunity to not just survive, but to flourish in their full potential. Thank you.
Thank you very much. And I understand we have technical difficulties and so need to put on our earpieces if we're going to hear the wise words of Dr. Tedros from WFP, who sent a video, please.
Midwives play a crucial role in providing high-quality care for women, newborns, and adolescents. It's estimated that universal high-quality midwifery care in all countries could save up to 4.3 million lives annually by 2035. To realize that vision, WHO is supporting countries to transition to sustainable midwifery models of care where midwives are the main providers for women and newborns from before pregnancy through to the postnatal period. Midwifery models of care are a cost-effective investment in equity, gender equality, and universal health coverage. And thank you all for your commitment and dedication to maximizing the role of midwives and creating a healthier future for women, newborns, families, and communities. Midwives.
Thank you so much. Oh, gosh, I can see myself on this now, and that is not good. If we can please turn to our excellent panelists and Your Excellency, Minister for Planning and Economic Development from Sierra Leone. Sierra Leone has made great recent progress in reducing maternal deaths. What specific policies or investments have been most impactful, and how can Sierra Leone sustain these gains? And once again, distinguished panelists, I'm afraid we are very tight on time, so I would ask you to jump straight in and tell us what we need to hear.
Yes, thank you. We really didn't tell me how long I had, Madam Chair and distinguished panelists, but just tapped me, because I could go on and on and on. But straight to the point, what are the policies and investments that have been impactful? Well, firstly, I would say strong political will overall is a principal factor. The government of Sierra Leone prioritized maternal and newborn health as critical indicators in our health system and overall national development. This was the reason why the president at the time declared a maternal health and child mortality emergency, public health emergency, which required urgent attention, not only by the government, but all stakeholders. And everybody rallied to this call. A situation room was set up that tracks maternal and child deaths across the country, and a dashboard was developed to show district performance in maternal and perinatal deaths. So improvement in the maternal and child health is central as an overall policy, and this is evidence that it was at the center of our last two national development plans. The previous development plan, 2019 to 2023, the flagship was human capital development, of which education and health were priorities. For this plan, 2024 to 2030, we have what we call the big 5 game changers. And the second game changer is human capital development. So that we maintained the focus is policy-wise on human capital development, still maintain the increase in expenditure and the priority of the sector. So very specific now to some specific initiatives, increasing skilled birth attendance. The skilled birth attendance has more than doubled, rising from 42% in 2013 to 87% in 2019. So actually investing in midwifery. As I stated, the government had recognized human capital development, the health sector, and investment in midwifery as one of the top priorities. Significant progress has been made in strengthening midwifery services. So because of the time, I just want to go through some of the areas very quickly. A national midwifery strategy was formulated in 2018, the first national midwifery strategy, and the second one will soon be launched. So that's actually strategically planning for interventions in the sector. Also, a number of midwifery schools the number has been increased from 2 in 2010 to 4, the most recent being opened last year to the east of the country. And this has led to an exponential growth in the number of midwives from approximately 100 in 2010 to 1,800 last year, thanks to the support. So other achievements are the establishment of a direct entry program, a nursing and midwifery council, and a real-time digital database for midwifery. So data generation has been very important, and there have been assessments that have helped us with our evidence-based planning. So there are challenges. The country's high poverty rate means that we want to train midwives. We have to provide scholarships for them to pursue the midwifery education. And additional support is needed to actually equip the midwifery schools and modern technology for skills, etc. So with the unpredictable landscape that has been referred to earlier on, the fiscal pressures that are available, they actually threaten some of the gains that I'm talking about. Another important challenge is the migration of human capital from our countries to seek better opportunities, probably in this country. Yeah. The government is taking steps to employ and deploy trained midwives. And in line with the rallying theme, the government of Sierra Leone gives assurance that we will continue to invest in midwives. for better health and well-being of mothers and newborns. Thank you.
And now I'm going to turn to His Excellency the Minister of Health from Zambia with a question about fully integrating midwives into the health sector is not without its challenges and pushback. How have you been able to counter this and also convince policymakers to continue investing?
Interestingly, Zambia has taken it upon itself, and everything actually depends on the leadership. When the leadership has a political will in terms of what it needs to do, everything falls in place. As we stand today, every community, the whole country, has got a health care provision. We're on the road of universal health care. We have got a fund which is called Constituency Development Fund. Political will is there by directing every leader, parliamentary leader, to construct health care. And that health care must have maternal annex. There must be water, there must be electricity. Purchase of ambulances, using of flying doctor in areas where there are emergencies. There are difficult areas during rain season, they are cut off. We now enhance the flying doctor services to go and pick mothers, those who are in the delivery stage. This, because of finances, government has improved actually its budgetary to healthcare services. It's now at 12%, looking at the 15% of Abuja declaration. It's hoped that we could be reaching, could be there. But of course, their challenges are that Zambia was one of those which had severe COVID-19. Cholera became a bit traditional. And last year, 2024, we were hit with severe drought. Animals died, affecting nutrition. Government has to come in. And of course, there's a deliberate policy on the human capital development. Government has opened up by bringing, education is key. When a mother is educated, even the hygiene levels improve. So there is a free education, despite all these difficulties the government is facing. There's free education, and all those poor people who were not interested in school because they could not afford it are back in school. And that also improves on the health care. Not only that, the government has a deliberate policy on recruiting health care services using Global Fund and other partners. This has gone a long way to mobilize community health workers who are working in the communities because they understand each other very well. I'll give an example of myself. When I was born, it was deep in the village, very far from services. My mother, I don't know who trained her. She was a caretaker, health, birth care taker. Every person was rushing to her. She became a center. Today, Zambian government buys bicycles for outreach, motorbikes. But what is important is establishment of healthcare services in every corner of the country. And this Constituency Development Fund keeps on increasing. And also a budget allocation to Ministry of Health also increases every now and then. Right now, this budget, we want to establish even level 1, get hospitals, ambulances. Every constituency has to have an ambulance. All this is meant to help health care for mother and child. Also, training. There's a training policy deliberately designed that some nurses, some courses are combined with nurses and midwifery. That's to increase the capacity.
Thank you.
Yeah, thank you very much.
Excellency, thank you very much indeed. And now moving to His Excellency, the Minister of Health from Nepal. And of course, Nepal is famous for its decades of determination to reduce maternal newborn mortality, and also a champion country signed on to the Midwifery Accelerator. What are your key priorities for midwives moving forwards, and what continue to be some of the greatest challenges in Nepal?
Thank you, Madam Moderator, for giving me the floor. Honorable Ministers, Excellencies, distinguished delegates and participants. First of all, let me appreciate all member states and UN agencies and organizing for hosting this very important event and giving me this opportunity to share our views. Let me express our happiness that Nepal is going to be a part of the global action plan for midwifery being launched today. It is also gratifying to note that Nepal has been selected as a champion country from Asia. Madam Moderator, let me stress that Nepal has given due priority to midwifery. We believe that prioritizing midwifery can make a transformative difference in improving maternal and newborn health outcomes. On this, investing in midwifery is not just a healthcare choice, it is a life-saving, transformative investment that empower communities, protect mothers, and nurtures newborn. We have established midwifery as a recognized profession with educational programs, professional registration, and clinic dedicated to midwifery-led care. 6 universities now offer undergraduate level midwifery program, and 2 institutions have launched diploma-level courses. Strategies and plans have been developed to strengthen midwifery services. We have developed and implemented the National Nursing and Midwifery Strategy 2021-2030 and the Human Resources for Health Strategy 2021-2030. Similarly, the National Midwifery Roadmap for 2024 to 2030 outlines a strategic pathway with clear policy objectives and interventions to build a sustainable midwifery workforce and enhance quality of care. We have ensured they meet international standards and contribute to national health goals. Madam Moderator, despite this progress achieved, multiple challenges persist. We are yet to fully integrate midwives into our existing health workforce. As an emerging profession, midwifery requires sustained efforts to foster understanding and support among policymakers, healthcare providers, and communities. Similarly, increased investment is needed to scale up midwifery education and development, particularly at the primary healthcare level. There is a need to address resource gaps, strengthen quality assurance, generate robust evidence, and promote midwifery practices across both public and private sectors. The government of Nepal is committed to overcome these challenges and ensuring the successful implementation of the National Midwifery Roadmap. Implementation of the Midwifery Roadmap would be key priority to sustain Nepal's gains to maternal and newborn mortality reduction. However, we need we need international support in terms of development cooperation, technology, capacity building, both international and human resources, infrastructure support, among others. This way, we can build a sustainable midwifery workforce, enhance midwifery education, ensure equitable deployment, and the quality of care for which Nepal is committed to. Our country is a mountainous country. We have rural area. There is no hospital. So we have to appoint midwifery in every birthing center of the country. So we are trying to do that. For this, I urge the global community to stronger partnership to overcome the challenges and deliver better health outcomes. I believe that this global roadmap will supporting countries like Nepal in fully integrating midwifery into their healthcare system and helping accelerate progress towards achieving our shared SDG goals, especially SDG 3. I thank you all. Thank you very much.
Thank you. Thank you, Excellency. And now we're going to turn, please, to the Director of Global Health for the United Kingdom. Given global and domestic events, the shifting landscape and demands, how can the UK and partners keep maternal and newborn health and the critical contribution of midwives centre stage?
Thank you. So I'm conscious of the time, so 3 quick kind of points for me, I'd say. I'd say, first of all, really increase domestic investment in midwifery. It's really important to build evidence-based advocacy that presents investment as strategic and cost-effective. And I think the Global Midwifery Accelerator, and congratulate the core group on the development of that, can be the basis for this. And I'd encourage others to build on that by making cases that are context-specific, that consider the difference between rural and urban areas in terms of deployment of health workers and access to health facilities. And to use these cases to push for the integration of midwifery into national health plans, because that's the way to ensure long-term funding commitments. So that's point one. Point two, I would really just highlight the importance of looking for innovation. So, for example, can we complement data-driven and evidence-based advocacy cases with existing grassroots movements that reflect the voices of mothers and attract media attention? So kind of really consider what the social benefits are in investing in midwifery. And then point three, I'd emphasize the importance of global partnerships as well. And again, the Accelerator Roadmap is a great example of collaboration to initiate change. But in its implementation, we now need to go further to ensure that key players are aligned and that midwifery models of care are prioritized. And the context in which we operate is changing. It's becoming more constrained. So we need to be flexible and realistic in our approach. And either within existing organizations or externally, we should really use relationships to encourage institutions to integrate midwifery into existing funding streams that are aimed at SRHR, gender equality, and health systems. And then global institutions, the GFF, the Global Fund, need to support the scaling up of midwifery globally. If midwives are embedded in strategies, policies, and technical guidance, that's the best way that we can really deliver that systematic change.
Thank you so much. And to our final panelist, the Chief Executive of the International Confederation of Midwives, the reason why we are here today. What are your 3 key action points that we need to hear, please?
Thank you so much, and thank you for inviting us. And it's true leadership also to see my fellow panelists at this table. Congratulations also to partners for the midwifery accelerators now being developed. We hope that that will have a huge push for many countries who make decisions. Speaking of leadership, the ICM, we truly believe that the health systems improve when midwives are recognized as autonomous leaders, not only healthcare providers, but autonomous leaders, as leadership is central to all of our efforts. We'd also work with and through our midwifery associations, namely about 117 of them, in different shapes and forms, to develop opportunities through initiatives such as the Young Midwifery Leadership Program, together with UNFPA and many other partners, the New Leaders Executive Sponsorship Program that will be launched quite soon, which then also fosters intergenerational leadership. Through policy and systems change, ICM advocates for senior midwife roles in ministries of health. And I think our panelists also showcase some of that. That supports the national midwife associations through the initiatives such as the Midwifery Accelerator. We also want to work with global partners even stronger to empower midwives in decision-making positions. ICM, we want to lead by example, and we want to advocate all countries and regions to appoint a chief midwife officer. Today, we have 17 countries with a chief midwife officer appointed at the ministry, 17. We need many, many more chief midwife officers who can speak up for the midwifery profession at national level. We work also through advocacy, namely the PUSH campaign, and in the entrance you will see some pictures together with UNFPA that we are launching the PUSH campaign 2.0, which really also includes the voices of the women themselves. And we believe that that is a very important way forward to actually collaborate with the civil society and with women's groups on the ground. And finally, we have to work together as leaders. We have to unite as leaders. That's the only way we can address the new geopolitical situation we are in, and also thereby to use the global midwifery accelerators in doing so. Thank you.
Thank you, and a round of applause and appreciation for our first panelists, and we're going to pass the baton.
Thank you, Princess Sarah. If I could request panelists of our second panel discussion to please make their way to the podium. Thank you.
Is there a seating order?
No, sit. Yeah.
Is there a seating order for us?
Yes.
By height. Or by length of statement.
Well, then,
So the shorter
No, I think,
shorter the,
no, yes.
the closer I am to this. Am I first or second? Yes, I'm. No,
First. Oh. It's okay. I think yes. Thank you, panelists. Given that we are running a few minutes late, we will do the introductions of our panelists once we come to the panel discussion. Thank you, Princess Sarah, for leading the first panel discussion. Good afternoon, Your Excellencies. Good afternoon, delegates, colleagues, friends. It is always great to spend an hour or two with champions of mothers and newborns. And the champions of mothers and newborns inevitably are also the champions of midwives, because you cannot speak of mothers and newborns' health without talking about the centrality of the role that the midwives play. My name is Fawzia Shafiq. I am the Associate Director for Maternal, Newborn, Child, and Adolescent Health at UNICEF headquarters, based here in New York, and very happy to be part of this group this afternoon. Enough has been said about the importance of the role that midwives play and about the huge challenge that we have in front of us to meet the goals for maternal mortality reduction and newborn mortality reduction as well. I'd like us to move from figures to people, individuals, human beings. I have, for several years in my own country, Pakistan, worked on maternal and newborn health, but also led UNICEF's health and nutrition programs, both in Afghanistan and Yemen. And I mention this because it was mentioned that around 64%, 65% of all mothers who die in conflict and humanitarian settings. A couple of weeks ago, we launched the annual estimates for child mortality, and 50% of all the children who die before the age of 5 also die in conflict and humanitarian settings. And having worked in these countries, midwives are important everywhere, but nowhere are they as important as they are when communities and countries are facing humanitarian crises. I'm really honored to be here and to be talking about the launch of the Midwifery Accelerator. Given that all the questions to our panelists are about how they would contribute to making the Midwifery Accelerator a success, I'm very happy to invite the Program Division Director of UNFPA, Ms. Julia Bunting, to take us through a few slides and talk about the Midwifery Accelerator, please.
Thank you, Fauzia, and good afternoon, delegates. UNFPA is delighted to be launching the Midwifery Accelerator on this World Health Day in collaboration with our partners, WHO, UNICEF, the International Confederation of Midwives, and JPIGO, and a host of other partners who form this coalition. I want to particularly acknowledge the champion countries, Bangladesh, Cote d'Ivoire, Nepal, Rwanda, Sierra Leone, and Zambia, for leading by example, by investing in midwifery, and for hosting the national dialogues that inform our collective efforts. We're here today because every woman everywhere deserves safe, respectful, and high-quality care before, during, and after pregnancy and childbirth, and beyond. And because we know from evidence that care provided by midwives is central to realizing this vision. Next slide. The good news is that today, women and newborns are more likely than ever to survive pregnancy and childbirth, with maternal deaths reduced by 40% and newborn deaths by just over 30% since 2000. But the progress is uneven, and it's slowing. Every day, 700 women die in pregnancy and childbirth, 1 woman every 2 minutes. And every day, there are over 6,000 newborn deaths and over 5,000 babies are stillborn. As we've heard, over 70% of all maternal deaths occur in sub-Saharan Africa, and 2/3 of global maternal deaths are in conflict and fragile settings. And for every woman who dies, 20 to 30 experience serious complications, often leading to lifelong health challenges and disabilities. While we celebrate progress, we know that the vast majority of maternal and newborn deaths and complications are entirely preventable. But lack of access to care and poor quality care significantly contribute to adverse outcomes. Evidence shows that midwives could prevent more than 60% of all maternal and newborn deaths and stillbirths by 2035 through achieving universal coverage of midwifery-led care. Despite overwhelming and long-standing evidence, the potential of midwifery models of care remains persistently unrecognized and underutilized. This is due to chronic and systemic underfunding, increased medicalization and routine use of unnecessary interventions, which are further hindered by gender barriers in the health system and society at large. To meet the need by 2030, nearly 1 million additional midwives are needed, and that is why we are launching the Midwifery Accelerator. Next slide. As countries strive to make the most of limited resources, midwifery models of care offer a proven, cost-effective and sustainable solution to achieve the best possible health outcomes. The Midwifery Accelerator documents 6 reasons why midwifery models of care are a best buy in global health. When we invest in care provided by midwives, We improve health across 50 outcomes. We increase access to maternal and newborn health services. We improve women's experience and satisfaction with care. We increase access to sexual and reproductive health services and advanced rights. We maximise resource efficiency, and we contribute to social and economic development and to gender equality. Next slide. The Midwifery Accelerator is a unified approach to catalyse collective efforts to integrate midwifery models of care within national healthcare strategies through a set of strategic accelerators organised under 3 pillars. The first is to commit and invest, to strengthen policy frameworks and increase domestic and global investments. The second is to educate, deploy and retain, ensuring quality education and professional development for midwives, deploying midwives strategically and retaining midwives by creating a safe, supportive and accountable workplace. And the third pillar is to advocate and empower, to build midwife leadership, to strengthen coalitions and amplify the voices of women and communities for effective advocacy and accountability. Alongside the accelerator, as I have mentioned, are 6 initial champion countries who will help to lead these efforts: Bangladesh, Côte d'Ivoire, Nepal, Rwanda, Sierra Leone and Zambia. Next slide. The Midwifery Accelerator kicks off an effort to engage new partners, inspire champions and work closely with country leaders. We will work to align governments and partners around shared goals, targets and strategies. It will do so through a twin-track approach. Firstly, programmatic alignment and complementary efforts, including the coordination of technical support and progress tracking towards the Every Woman, Every Newborn, Everywhere targets to drive progress towards the achievement of the Sustainable Development Goals. And secondly, through advocacy, accountability and global communications, including leveraging existing partnerships, such as the Partnership for Maternal, Newborn and Child Health, and importantly, an annual breakfast on the sidelines of the World Health Assembly to keep the drumbeat going and to ensure progress and mutual accountability. Last slide. So with that, let me hand back to our moderator to explore how we can build momentum for midwifery models of care and secure new commitments to stronger financing, policies and programmes to accelerate progress in countries. Thank you.
Thank you, Julia. That was very clear, very informative. 3 pillars, 7 accelerators, presented really well. Thank you for that. With that, if I could move to the first question, which I'd like to pose to the Deputy Permanent Representative of Germany, His Excellency Thomas Sennhausen. We've just heard about the pillar 1 being around investments, and we've also heard earlier this morning that there is immense and irrefutable evidence that investing in midwives is the right investment. It's the most cost-effective intervention that we have available to make an impact on maternal and newborn health and mortality. And yet we know that in most of the countries where these investments are most needed, they remain underfunded. Could you give us some advice, guide us on how we can communicate better the value of investing in midwives to the decision makers, be they decision makers in health or in the broader development sector or others who work in both humanitarian and non-humanitarian settings?
Thank you, Fauzia. This is a difficult question. I'm struggling with my notes, so I will speak freely on that. First of all, thank you very much for organizing this, to all the co-hosts, and thank you for having me on the stage with all these distinguished speakers and specialists. I'm not a specialist, so I ask myself, why am I sitting here? So I think it has something to do with the fact that we've been a long-term partner with UNICEF and especially UNFPA on the question of midwifery. And this partnership goes back for many years, more than a decade, and it is particularly centered around the Maternal and Newborn Health Fund. And this fund is for us an absolute crucial cornerstone of what we want to achieve in a successful maternal health strategy that is centered around midwives. And that's why we very much welcome any idea that accelerates the idea of giving due attention and due focus on midwives in maternal health. And that's why we welcome the Accelerate and, of course, this campaign. Now back to your question, how we can scale up midwifery-led care. Again, I don't have a compelling answer. I just know what the discussion we had in Germany a couple of years ago, where we were becoming more and more robotic in the way we deal with birth. I mean, it was hospitals, happy you nod, and I think it was only about economics of scale, et cetera, but that is really not the reality of the economics of delivery birth. I think you can make a very, very compelling case that midwife-led maternal health care is not only efficient, it is highly efficient. And I think the data is known, we know the evidence is there, and I think what can we do to advocate the case? Yes, make the numbers speak, deliver the facts, and invest in further data analysis in order to make the case even more compelling. I think this is the economic case, and the economic case of cost efficiency goes way beyond the efficiency itself, but economically speaking, using midwives is creating externalities. There are a lot of things involving midwives, such as you have a different relationship between a mother and a family, which is not only confined to the birth itself. It is a midwife knows way more than delivering a baby. So she has a relationship with a mother for a long time. So she gives advice which would be otherwise dealt with in a less efficient way. And finally, they are the backbone of the health system, and they are really good in outreach to communities. So all that, the externalities of the economic case are almost more compelling than the cost efficiency of the case. So that's number one. The second one, I think, is a moral case. It is about how we deal with each other. I mean, we heard it many times that maternal death is most of the time avoidable. So it's a question of political will, yes. But it's also how we perceive ourselves. I just came back from the UNICEF Bureau meeting, and we talk a lot about rights and autonomy and making choices. And I think this is also part how we deal with each other. This is not about charity, of providing service. It is putting a mother that gives birth to a child at the center of what we're doing. And the choice of having a midwife as a partner is a right. And at a time when we see rights challenged, I think this is another case that, at least in my country, we would like to make why this is so important. It is the economic makes sense, and this is all about rights. I'll leave it there. Thank you.
Thank you. Not just efficient, but highly efficient, you said. Thank you for saying that, and thank you also for reminding us that in health, it's an economic case that tends to go the longest with the decision makers who are outside of the health sector, so making an economic case for the midwives. Julia mentioned that one of the 6 countries that are going to be leading the work on the midwifery accelerator is Bangladesh. So I'm really happy to have Professor Muhammad Sayyidul Rahman, who's a special assistant to the chief advisor of the interim Bangladesh government with us. Welcome, Professor. Bangladesh, we know, has made huge strides, generally in health, but especially in maternal mortality reduction, almost a 2/3 reduction over the last 24, 25 years. But we know that in the country, we are still struggling in making sure that quality maternal care is available to all mothers, but especially the mothers who are in the most remote areas, who are the most vulnerable. And Bangladesh continues to grapple with the challenge of adequate health workforce, especially midwives. Could you speak to us about what is Bangladesh's current commitment to midwives, and how will you make sure that we have adequately trained midwives available at all levels of the health facility? And I hate saying this, but we are running a little behind time. So if you could maybe take 2 minutes with your reply.
Sure. Thank you, Fawzia. Yep. The government is actually committed, and their commitment is reflected by creating 3,000 positions of midwives were created in 2010 when there was no midwives at all. So Bangladesh created position of midwives when they had no midwives in the country. After 3 years, they've introduced the course of midwifery course in 2013. So that's a clear reflection that the government was committed to midwives, how much they have committed to. Then onwards, they've started accelerating improving the courses from the diploma to the graduate courses. And after 3 years, in 2016, they've introduced BSc in nursing. And in 2026, in the next year, we are going to introduce MSc in nursing. And in the same pace, actually, we're creating positions at different level, that is in the primary and secondary level. The midwives are the key position. But your question is, if we talk about the access of the potential mothers to the midwives at the remote places, that is still a challenge because we have a huge, extensive network of primary care facilities around but we cannot place actually right at this moment. We have only around 2,500 midwives in place, and we have a plan to actually incorporate. Every year, we are trying to incorporate more than 2,000 midwives each year, and we need 25,000 midwives for the nation. So we have 8,000 in hand. We'll actually employ 2,000 plus in every year. So we're optimistic that we will be able to actually recruit, and we can educate and recruit sufficient number of midwives as required by the need of the country. So that's actually our commitment is reflected through our plan. So I hope that I could respond to your question.
Just maybe a 20-second reply on in terms of the financial commitments from the domestic resources.
Yeah, it's all from domestic resources right at this moment from GOB funding, but we are greatly appreciate the support, that is technical assistance from UNFPA and UNICEF and other organizations. But right at this moment, 85% of the whole of the funding is from our GOB fund. So only 15% is from the development partners. So that reflects that we are really committed to. Thank you.
Moving on to our friend from Luxembourg, the permanent representative of Luxembourg to the UN, His Excellency Olivier Mays. Bangladesh is an outlier in that the government has always invested heavily in health, and that's something that's to be applauded. But that is unfortunately not the case in many of the countries where maternal mortality rate continues to be high. We are seeing unprecedented ODA cuts, debt crisis in countries, and a funding situation that's fairly gloomy. Talking again about the pillar one, which is around investing, how can partners like yourselves help countries prioritize investing in their national health budgets on midwifery and mobilize greater investments within their governments? And are there any financing mechanisms that are available to encourage countries to put greater domestic resources in midwifery? And if they are, could you speak to those, please?
Thank you. How much time have I got?
Around
this is a big question.
2.5 minutes.
I'll try to be highly efficient as well. For Luxembourg, it's an honor to be part of the launch of the Midwifery Accelerator, and we really thank UNFPA for its leadership. And indeed, it's strategic to invest in midwifery for public health and development because ultimately it's a cost-saving solution. If you invest more in midwifery, you will have lesser costs downstream. I'll give just one example of a mechanism that can be used that was already mentioned by my colleague from Germany. It's the Maternal and Newborn Health Fund by UNFPA, which allows, of course, international donors like Luxembourg and others to contribute to develop midwifery, but it's also a tool to add also other sources of financing. So this Maternal and Newborn Health Fund, since its inception, has supported over 30 million safe births. It plays a catalytic role in 44 high-priority countries. And this fund embodies a strategic shift from merely funding to a broader approach that includes financing. What do I want to say by that? This fund supports countries in developing sustainable and diversified financing strategies, which may include innovative tools. Just to give a few examples, you can have social bonds to help you fund your midwifery strategy. You can have impact investments, and you can also build partnerships with the private sector. And by fostering these partnerships, the fund aims to reduce reliance on external funding sources that are indeed under heavy pressure. You mentioned the funding cuts that we see all around the world nowadays. And these partnerships help countries develop a more sustainable financing system. For Luxembourg, we also try to support initiatives where the various UN actors work together. And I will just give one example in the Lao People's Democratic Republic, where there is a joint UN program with UNFPA, UNICEF, and WHO. In this context, in 2024, last year alone, there were concrete results like the development of a national midwifery action plan, provision of scholarships to future midwives, and also digital tools which enable real-time monitoring and better decision-making. So these examples make it clear that you need targeted investments, you need to have political leadership and national ownership, as was mentioned in the first panel. You need the support by international donors and UN actors, but of course you need also strong domestic resource mobilization strategies to ensure that midwifery is fully integrated into national health priorities, strategies, and budgets. Thank you very much.
Thank you. It's great to hear about the fund, 44 countries, and bringing innovative financing into it to encourage domestic investments into midwifery. I'd like to move from the pillar 1 that we've been discussing so far to pillar 3. As Julia presented, it's the pillar around advocacy and empowerment. And I'd like to ask our friend from Sweden, the Deputy Permanent Representative of Sweden, His Excellency Andreas on Oxkel, about Sweden has a tradition of championing midwifery, both at home and internationally, but also has a tradition of playing a catalytic role in amplifying voices around key issues around maternal, newborn, and child health. So, like we did with the earlier panelists, your advice on how Sweden can play a bigger role in championing midwifery at high-level policy development and amplifying the advocacy effort that we are undertaking with the countries.
Thank you very much for the question, Sia. Thomas, my German colleague, you mentioned that you're not a specialist of midwifery, and I'm on the same page there. But I have a lot of childhood memories from midwifery. My father was a gynecologist, and he was lecturing about how to avoid sexual diseases and other things. But more importantly, my mother was a midwife, and she told me a lot about childbirths, and I will always remember the warmth. She was speaking about the most important moment in your life and how she was part of that moment. So this is something I've brought with me as I have continued to work. Midwife is one of the oldest professions in the world, actually. Actually, the mother of Socrates, the old philosopher, was a midwife. And in Sweden, we have a history of educating midwives for over 300 years. So it goes very long way back in time. And actually, we believe that having had educated midwives has helped us to decrease the maternal mortality from around 900 to 4 per every 100,000 live births. So the statistics really talks about the importance of educating midwives. And investing in midwives actually is one of the most cost-effective ways of saving lives. And in Sweden, we have a right to access, or expectant mothers have right to access of quality midwifery care before, during, and after pregnancy. So Sweden will continue to stand up for the global advocacy and encourage other nations to appoint chief midwifery officers, like Anna of Ugglas mentioned in her speech. And we will also continue to strengthen national midwives associations and global networks. And we will also continue to our partnership with UNFPA and WHO and other international confederations for midwives for midwifery education in low and middle income countries. And we will also continue to support UNFPA. And just to give two examples, one is the maternal health care fund that you mentioned, and where we have actually, via the Swedish support, helped 2.8 million women to have maternal care, and also trained 180,000 midwives out there. And one example also Bangladesh as well, where we have helped establish 120 midwifery educational programs. So we will continue to stand up for these matters that are extremely important. Thank you very much.
Thank you for the commitment, but thank you also for sharing that fact about your mother. It gives me an excuse to talk about a TV program that I highly recommend to everybody in the room. If you haven't seen Call the Midwife, a British period drama based in 1950s and 60s, we exchanged notes, Princess Sarah and I, about how we regularly watch it and cry over it. So anyone who feels they're not an expert, I highly recommend that you watch it. Makes the whole thing very real and very close to one's heart. Moving on to the last panelist, a very important question to our colleague from Mexico, Madam Teresa Ramos Arreola. She's the Director General of the National Center for Gender Equity and Sexual and Reproductive Health. We'd like to ask about Mexico's experience with training and deploying midwives, and the challenges that you've had to overcome both at the national level and at the subnational level. And many of these challenges remain. So what is the plan moving forward in Mexico on making sure that we have enough midwives, but that they are trained well and they're deployed in the right places in the country?
Bueno, muchas gracias. Muy buenas tardes. Lamento que no haya traducción en español, pero voy a dar mi mensaje. En este Día Mundial de la Salud es un honor representar a México, un país totalmente comprometido con la igualdad sustantiva y la salud sexual y reproductiva de nuestra población. México ha avanzado significativamente en la reducción de la mortalidad materna y neonatal en los últimos años. Según datos oficiales, las acciones implementadas entre 1990 y 2023 contribuyeron a una disminución del 59.4% en la razón de la mortalidad materna, pasando de 85.2 a 34.6 muertes por cada 100,000 nacidos vivos, y en el caso de la mortalidad neonatal disminuyó el 31.4%. Este avance se atribuye a la implementación de políticas públicas enfocadas en mejorar la atención prenatal, la capacitación del personal de salud y la integración de modelos de atención que incluyen a parteras profesionales y tradicionales. En nuestro país, muchas comunidades carecen de hospitales cercanos y las parteras tradicionales y profesionales son el primer y a veces el único punto de atención para las mujeres embarazadas. Su labor permite garantizar partos seguros y acompañamiento durante todo el proceso perinatal. Además, otorgan atención basada en conocimientos ancestrales, respetando la cosmovisión y las tradiciones de los pueblos originarios. Integrar a las parteras en los sistemas de salud ayuda a reducir la sobrecarga en los hospitales y en las clínicas. En países con escasez de personal médico, las parteras profesionales pueden atender hasta el 87% de las necesidades de salud materna y neonatal, según los datos del Fondo de Población de las Naciones Unidas. Además, los servicios de partería son más costo efectivos, ya que previenen complicaciones que podrían requerir intervenciones médicas costosas. Reconocer y fortalecer la partería contribuye al cumplimiento del objetivo del Desarrollo Sostenible 3, que se enfoca en la salud y el bienestar, asegurar vidas sanas y promover el bien para todas las edades, con énfasis en sin dejar a nadie atrás. El Objetivo de Desarrollo Sostenible 3 apunta a la interseccionalidad de la pobreza, discriminación, problemas de salud y poblaciones claves, además de reducir la mortalidad. En México, con el respaldo de la presidenta Claudia Sheinbaum Pardo, se publicó el pasado 4 de marzo la norma 020-2025. Esta norma reconoce por primera vez la partería en México como parte fundamental del sistema de salud, promoviendo su integración en la atención materna y neonatal. Valora y regula la práctica de la partería profesional, promoviendo su integración en los equipos de salud y fomentando la vinculación con parteras tradicionales. Además, contempla la creación de casas de partería, unidades de parto de bajo riesgo, permitiendo la presencia de parteras tradicionales durante el proceso de atención. Y este avance es clave para garantizar su reconocimiento, vinculación y acceso en la atención integral materno-neonatal. Tenemos información del 2024 y en México se cuenta con un registro de 12.329 parteras tradicionales que ejecutan su labor en 27 de las 32 entidades federativas. Y en ese año atendieron 107.808 mujeres gestantes, 11.624 partos sin complicaciones y refirieron a alguna unidad médica solamente a 48 partos complicados. En lo referente a las parteras profesionales, para este mismo año se cuenta con el registro de 348 ubicadas en 13 entidades federativas. El 88% son mujeres y el 12% son hombres, por cierto. Este hecho de reconocer y fortalecer la partería no solo es un acto de justicia social y cultural, también es una estrategia clave para mejorar la salud materna y neonatal, para reducir desigualdades y fortalecer el sistema de salud en México. Se encuentra alineada además con los objetivos de la Estrategia Mundial de Partería 2018-2030 del Fondo de Población de las Naciones Unidas. Además, en nuestro país tenemos también el respaldo normativo que el 29 de mayo del 2023 se reformó en la Ley General de Salud y está estipulado en el artículo 64. Y ahí se establecen las acciones de capacitación para fortalecer la competencia técnica de las parteras tradicionales y la incorporación de la partería profesional en los servicios institucionales de salud. Estamos conscientes que de aumentar las inversiones en parteras y en la calidad de la atención de partería, se podrá cumplir con el Objetivo de Desarrollo Sostenible en Salud 3, que busca reducir la tasa mundial de mortalidad materna a menos de 70 muertes por cada 100.000 nacidos vivos para el 2030. Y asimismo, en México, con los avances de la reducción de la mortalidad materna, los determinantes sociales y la reciente promulgación de la norma 020 que les mencioné, para establecimientos de salud y reconocimiento de la partería en la atención integral materna y neonatal, se está alineando sus políticas y acciones con la Estrategia Mundial de Partería 2018-2030 del Fondo de Población de las Naciones Unidas. Y bueno, cierro mi participación comentándoles que en México tenemos una frase. Hoy tenemos a la primera mujer presidenta y con ella llegamos todas. Gracias.
What we're going to ask is for the closing remarks, first of all to say thank you once again very much to our distinguished panelists, to turn closing remarks, if you could give them from where you're seated, I think is probably the fastest and most efficient thing, to say thank you so very much to everybody who has worked so very hard to organize this event, and to turn over to you, please, Abdul Karim and Ferry, for your final comments on the future of midwifery.
Okay. Thank you very much, Princess Sarah. Dear Your Honor, Princess Sarah, distinguished ministers, delegates and partners, and fellow supporters of midwifery. I'm Nita, a young midwife leader from Indonesia. I'm so honored to close this session along with my colleague, Abdul Karim. Today marks a critical moment as we launch the Midwifery Accelerator, a bold commitment to strengthen maternal and newborn health and well-being by recognizing midwives as the backbone of care. It's inspiring to see how the champion countries, UNFPA, UNICEF, WHO, ICM, JPICO, and partners that have come together to shape this midwifery accelerator. I'm also inspired by all of you who have passionately addressed the maternal in the importance of pillars and also the key actions of midwifery accelerator, and each serving as the cornerstone to expand midwifery models of care. Thank you so much for your commitment and dedication. Distinguished delegates, as again heard here today, midwives significantly improve maternal and health outcomes. They improve mothers' experiences and also strengthen the entire health system. That's why, no matter where we come from in the world, investing midwives matters, and it is a smart investment. In my country, Indonesia, consisting more than 17,000 islands, each midwife is assigned to a village, from the most urban centers to the most isolated area. Imagine a pregnant woman in a very remote village undergoing labor in the middle of night. Who serves as her lifeline? Yes, a skilled and equipped midwife. The midwifery accelerator, which we have collectively launched today, is a pathfinder for a country like Indonesia, and it's more 500,000 midwives who provide care for over 4 million births each year. The impact we midwives have is far-reaching. As midwives, we touch the life of families at their vulnerable and their most powerful moments. With the support we deserve, we can transform millions of lives, ensuring healthier pregnancies, safer deliveries, and healthier newborn. Distinguished delegates, I urge you to invest in midwives. This is not just about today. It is about the future, where every midwife is educated, equipped, and supported to ensure every woman, everywhere, has the access to the high quality and respectful care. And every woman and newborn is valued, protected, and given chance to thrive. Thank you.
Thank you so much.
Karim.
Thank you. And we're going to, if I can just recognize the CEO of JPICO who is in the room, and ask Abdul Karim to give us 30 seconds of last thoughts, please. And
I'll
thank
give you
again.
30 great seconds, don't worry. Thank you, Your Highness, and thank you, Anita, for giving me the floor. It's a bit intense up here in the podium, so I'll make it really, really brief. But as a young medical doctor and as the Danish youth delegate to the UN, it's a great honor to address this matter on the World Health Day. Denmark and the Danish youth strongly supports the important role of midwives in achieving the sustainable development goals. We believe that when we invest in midwifery care, we invest in health, rights, and the well-being of our entire communities. So while we're all gathered here today at the UN, I would like to emphasize that these kind of investments are those that ensure that when young medical doctors, such as I and my fellow professional colleagues, put on our coats, it's not just as a symbol. It's not just as a uniform. It's more than that. It's a symbol that shows that it's our shared commitment to shaping a healthier future for the future generations to come. The Midwife Accelerator is only the beginning, but we've shown now that the path is clear. We need to act, and we need to act now. We owe it to ourselves, the current generations, and the future generations to come. Thank you.